Hi, everyone. Welcome back to the Mass Swingers. Today, we're excited because we have a doctor, an OBGYN, that's going to be answering a ton of questions that you gave us about things like BV, periods, birth control, UTIs, et cetera, et cetera. If that sounds exciting for you, then this is an episode that you're not going to want to miss. Don't forget to like and subscribe. And with that being said, let's hop on in. Well, everyone, welcome back to another episode of the Mass Swingers. I'm here with Layla, of course.
Hi.
And today we've been talking about getting a doctor on the podcast for quite some time
We've
now.
needed to, yeah.
And we finally got one. We got one to
Yes!
come on. They are wearing a mask.
They
They're
are.
going by Ariana today. Would you prefer Ariana or Dr. Ariana?
Probably Dr. Ariana to keep it formal, you
Yes,
know?
Okay.
ma'am.
Yeah,
Dr. Ariana. So Dr. Ariana, MD. Would you like
correct.
to tell them what type of MD you are?
Yes, I am a physician, OBGYN. I practice as a generalist, so obstetric and gynecology.
OBGYN. So you're a lady doctor? How do I
Well, yeah,
you're a
I look at
doctor
vagina
for
parts,
yes.
exactly.
All right. But you don't just do you do surgeries also. Like what do you cover?
Yeah, I do full scope practice, so obstetrics and gynecology, depending on like what you want your career to look like, your day to day. You know, you could be doing clinic, you can be in the operating room doing surgeries. I'm also on call in the hospital delivering babies, doing C sections and things like that. So yeah, it's both ambulatory medicine and surgical specialty as well. I try to do it all.
I went to college for like 1 semester and was like, "I'm done. Thank
Mhm.
you. I'm all done. Thank you." So like,
Yeah.
thank God there's people like you that are just smart and go to school and help us all out.
Yeah, I have a feeling you're about to use some big words.
Yeah.
And we
No.
will if you throw big words out there, we'll just put subtitles and we'll just say the word and define it in a
No, I'm
pop-up
not
bubble.
gonna.
So we're happy you on because we get a lot of questions. But actually, before we do this, just want to make sure people know that anything you share in this is just you're providing general medical knowledge. You're not giving people specific advice to their specific situation, and that they should go talk to a doctor for sure before they take anything you say and apply it to themselves. Right?
Correct. This is just gonna be pretty general. I'm not your OBGYN. I am an OBGYN. So yeah, I don't know your medical history, your surgical history, what's going on right now for you. So any answer I'm giving is gonna just be general application.
I have a question right off the bat. When I first entered lifestyle 4 years ago, I got BV and
Mhm.
I didn't know what BV was. It's not something that's like talked about or it's not like a thing. So when I got it, I like smelled really bad for like months until I finally went to my doctor and they're like, you have BV. And it turns out
Mhm.
it's very common.
Yeah.
So can you explain more about like how to get BV, how it's treated?
Yeah. So generally, you kind of have to take a step back. And if you think of like the umbrella term of vaginitis, which is infection and inflammation of the vagina, and actually also might include the vulva too. And by the way, vulva and vagina are not the same thing. Some people like to conflate the two, but they're actually two separate parts of the genitalia.
What's a vulva?
so the
Shut
vul-
up, don't look at me.
so, vulva, external genitalia with like your labia majora and then your labia minora, right? And then the vagina itself is talking about the inside, the canal,
Okay.
right? So, you have the vaginal opening, your introitus, and then on the inside, that's the vagina. So, you can have irritation and inflammation of all of that, right? And so, when we think of the most common causes of vaginitis, it's going to be BV or bacterial vaginosis, like you talked about. There's also candida, or like as we call them, yeast infections, and also trichomoniasis. So we kind of have to think about all three of those when we're talking about like, does my vagina smell? Is it itchy? Is discharge coming out of the vagina? And when you're talking about BV, it's very prevalent. 30% probably around. It's probably more than that, honestly, but we usually quote 30% prevalent in the US. And actually most of BV is not symptomatic.
Oh,
Right. So bacterial vaginosis is a syndrome. We look at the vaginal microbiome, it is made up of a bunch of organisms, right? You have mostly lactobacillus is going to be your dominant organism there. And then you're going to have other random things, Gardnerella, mycoplasma, ureaplasma. you're gonna have Prevotella, you're gonna have weird things, names that sound like Greek goddesses, okay? And it's really like bacterial vaginosis is what we call like it's basically a dysbiosis of all of those things. And so what happens is the lactobacillus goes down and the bad bacteria goes up. So it's really just an imbalance. What happens is the lactobacillus, it creates an acidic environment for the vagina that's necessary to kind of keep it clean, keep things functioning. And when that lactobacillus goes down, or you just have like a non like lactobacillus dominant vaginal microbiome, you have overgrowth of the other bad organisms. And most commonly, it's going to be vaginalis that's causing BV.
Interesting. How do people primarily get BV?
You can just have BV if you have like difference in pH. Random things can throw that off. You can be douching. You can be sitting in yoga clothes for a really long time and just like a moist environment. Sexually active people tend to get BV. So, male and female intercourse can, but also you have increased risk of BV in female to female sex. You also have like increased risk if you're sharing sex toys. There are other things like if you have a copper IUD that's been shown to increase your risk of having BV too.
Interesting,
So,
because I've heard people say that you get BV because you're dirty or you played with someone that has a dirty penis. Is that also kind
no,
okay,
that's more like yeah, I don't know who exactly is saying that, but it's more like shaming people, right?
yeah.
Bacterial vaginosis is super common. I even feel a little sad for like, when my patients are coming to me and they're talking about, oh, I have this. First of all, they're really like apprehensive to even tell me because they're ashamed, right? And their friends aren't talking about vaginal discharge because all of their friends are posting on social media that they have like strawberry tasting champagne brunch vaginas. Like, I don't know where they get the idea, but vaginal discharge is common. You need vaginal discharge. You can't just have a dry vagina.
Mm.
Actually, vaginal dryness leads to more infection. So you want vaginal discharge. Your discharge is also going to change in your menstrual cycle. It's going to change towards ovulation and then leading up to menses, like when you're bleeding, it's going to change too. So yeah, it's not about really it can kind of be about cleanliness, right? Obviously, if you're not like washing, or actually, if you're washing too much with like soaps or things with like preservatives or fragrance or something like that, you can throw off the vaginal pH and cause.
Really, just from, like, soap and stuff, you could get, like, BV or infections,
Yeah,
just soap.
we recommend not douching. A lot of people douche. I think like I don't know if your mom did, but like
Probably
ju-
she's
just
something
like
else.
older generations used to do like a vinegar douche in the vagina,
Mhm.
right? Kind of like the same thing we think about. Oh, is my vaginal pH off? Like they put vinegar in the vagina and kind of lavage, do like a vinegar lavage, but like
Yeah.
that's not recommended.
Are there any soaps that are and I'll let you get in here in a minute, but I'm very curious about my own vagina. Um, are there any soaps that are okay for the vagina? Because I have, like, Summer's Eve. Is that bad?
We honestly just say water. Warm water is all you need
But
to
then my
wash the
vagina will still
outside.
smell.
So we have to ask ourselves, like, why is it smelling then? And what is the smell that you're smelling? Do you know what I mean?
Yeah.
So kind of like I facetiously like alluded to before, but it's like not supposed to smell like roses,
Right.
right? There is just like a healthy smell to the vagina that we kind of have to embrace.
Mhm. And, like, sweaty is okay 'cause it doesn't smell like an infection or anything like that, but if I don't use soap, it'll just kinda smell like a regular vagina, and
Yeah.
I don't want that.
You mentioned earlier though that like there was like a fishy odor to BV. Yeah,
Yeah.
it shouldn't smell like that, right? Something like that should prompt you to go to your doctor to just at least get a swab. So we literally just say wash with warm water. If you're washing with any sort of soap, make sure it's like non-fragrance and hypoallergenic. Those things like Summer's Eve, Vagisil, you just really don't know what they're putting in their product. I don't know. It could be oil-based, petroleum-based. I'm not exactly sure, but they're adding preservatives and sulfates and things like that that we just don't know what's in there, right? It's
Right.
not like an FDA approved
Mhm.
product,
Okay.
right?
Ugh, I don't wanna just use water.
I know because you want it to like smell good
I do, I want
fast.
it to smell like roses or I want it to smell like nothing at all. And
Mhm.
there are some guys I've been with that they're like, "I want to smell your vagina. I don't want it to smell
Mhm.
like nothing." And then there's other men or people that are like, "I don't wanna
Well,
know that I'm down
and
there."
sometimes the smell is like I've been at parties, right? And because obviously that's what we talk about on this show sometimes, and
Mhm.
like sometimes it smells too much, and like it kind of take over the room,
Mhm.
and you're like, oh man, what is that, or who is that smells that way? And then I do know that I can't remember the acid, but for a while there was something women were taking after parties or
Boric
before
acid.
boric acid, and so there's this wave of women who are getting UTIs or
Mhm.
BV after parties, and so
Yeah.
they were all saying we should all take boric acid or do some sort of procedure to prevent it. So are there things that people can do to prevent it, and do you recommend those things or do you shun them?
Yeah, so boric acid is a nice tool to have. It's nice to have in your bathroom cupboard. We use boric acid for a couple of things. We could use it for foul odor if you have already ruled out infection, right?
Mhm.
So if we've done a swab on you and we've done an exam and we say, okay, you have bacterial vaginosis, our first line would not be, and bacterial vaginosis is associated with like a fishy smell. If we said that you have BV, it's not the first line to treat you with boric acid, right? You have to be treated with an antibiotic.
Mhm. Will it ever go away without an antibiotic? Like, does it ever go away on its own?
Yeah.
I mean, the thing is it can go in between symptomatic and asymptomatic.
Okay, but it's still always there, but it's just you either
It's going to be there as long as there's an imbalance in the organisms that are in your vagina.
okay. Can you spread BV to other people?
BV is not considered to be a sexually transmitted
Okay.
infection,
Okay.
which is why when women are dealing with BV, it's not necessary for you to treat your sexual partner,
Got it.
right? Most of the time, if we're having STDs, we're also treating our partners or
Right.
treating our sexual partners. So you would ordinarily be, if you have BV, be treated with something called Flagyl or metronidazole. You would be like twice a day for 7 days,
Done it a couple times. But
right?
then when I take it, I get a yeast infection
Mm-hmm.
directly after that.
Mm-hmm. Mm-hmm.
What's the fucking deal?
Right. Any sort of antibiotics you take for anything, upper respiratory infections, gastroenteritis, UTIs, BV, is going to also affect your vaginal microbiome. So, usually, what I would do is I would give my patients the treatment, either Flagyl, like we talked about, or topical, vaginal Metrogel or clindamycin. And then I would also give them diflucan. So I would give them something to treat a yeast infection, flanking your antibiotic
They take at the
regimen.
same time, or like they
No,
start taking
after,
as soon as
right?
you're
I would
done?
take it before and then I would take it after.
Oh wow. So you're like
Oh.
priming it, doing the antibiotics, and then supporting it
Kind
at the
of. You
end.
know, the thing about it is like there's no consensus on the exact regimen. We just do know that antibiotic exposure does increase your risk of having a yeast infection. So if we're going to give the antibiotics, might as well give
So that's a further reason like not to be taking antibiotics you don't need to take.
Right. Right.
as well. Yes,
Right.
that too. We want to be stewards of antibiotic
Yeah.
use.
Yeah. No, absolutely.
So this is like a common misunderstood thing, but I'm sure you deal with, especially with social media, a
Hmm.
lot of patients coming in asking you a ton of questions that are, I don't know, hot topics that they misunderstand, and you're debunking things
Hmm.
often. Yes. Uh,
Yes.
yeah. Are there some? Are
Okay.
there some that you're debunking more often than others?
Um, I mean, there's a lot. I'm not even sure some are specifically coming to my head, but I guess while we're kind of on the topic of like yeast infections, a lot of times people confuse yeast infections and UTIs. I think that's a very
Oh, yeah.
commonly confused situation. And it's understandable that it is right. Those two holes are real close to each other,
Mm-hmm.
right? You have your vaginal opening, and then you have the urethral meatus, the opening to your bladder, and then the rest of your urinary tract. So if you are like, for example, having sex, and like we already emphasized, there's a bunch of bacteria in that area. You can push bacteria from the vagina and external genitalia and we have bacteria on our skin too. You can push it into the urethra. Okay, and that's how the bacteria then enters the bladder, and then you have a UTI. So a lot of people will confuse the two of those. They can happen concurrently. Um, and some of them might even have the same symptoms, right? Dysuria or pain
Right.
with urination. You can have vaginal irritation. So those two get confused, and I would say that go to your doctor.
Yeah.
You need an examination. You probably need to give a urine culture. You probably need to get a vaginal swab. I think with the advent of like telemedicine, and also after COVID had happened, we had an uptick in the reliance on telehealth in terms of like how we diagnose and how we treat. But it often leads to misdiagnosis and overtreatment with antibiotics. So I think like if there is anything to be said there, you just cannot like supplant the like importance of like going to your doctor, giving a good history, getting an exam, getting the appropriate swabs for like diagnostic accuracy.
hmm So for people like us that are going to like sex parties and
Yeah.
have like multiple partners, is there anything that you would suggest that we do to prevent those things like the BV, the yeast infections, all that?
Condom use, honestly. Condom use is going to help. Washing sex toys between use, making sure maybe we're washing between partners.
hmm
When you say washing between partners, what should they be washing? Because I always hear that, and like
Yeah,
for me, it's like I know I just wash my shaft, right? But like, what should a woman be washing?
like on the outside too, we really don't want to be sticking our fingers in the vagina and like scooping things out of it, right? You should also be, you're probably also using a condom too, so you're really maybe not even scooping anything out,
Right.
just general hygiene and
Yeah. And washing your hands, which I was actually listening to the episode on the way up here, that not enough people are washing their hands at these parties.
for sure.
Like I'm looking around and I'm like, I'm not, why? There should be more people in line to wash their fucking
Like in
hands.
line for the bath, like they're probably
Yeah.
using the like are wipes good enough? Like often the parties will have wipes. They're not quite baby wipes, but like example like baby wipes, for example, and like the line for the bathroom is really long, so maybe you just use baby wipes. Is that good enough, or should it really be soap water?
I mean, it depends. I think soap water is probably your best bet. Those wipes may not be antibacterial. Not
hmm
exactly sure what those wipes are.
We don't either. It's dark in
Yeah.
there. It's dark in there.
Well,
You like
also,
cannot read the
there could
label.
be alcohol on it, and like my sensitive little vagina, that might sting or something, Like just, it takes 2 seconds to wash your hands. Do it in the
Right.
kitchen,
And I like to think about it like, when you're in the public restroom and you're at a restaurant, it has a sign up there like restaurant workers, you got to like be washing your hands after using the
Right, right.
bathroom. And for the same reasoning, I think you would want to be washing your hands
So
between
treat it like a
sexual
restaurant.
partners. You know what I mean?
It
Like
is
no
kind of
shirt,
like
no shoes, no service, no hand
Yes,
washing,
no
no
service.
dick
yeah, it is
touching.
kind of like a
Not
Exactly.
in
kind of
here.
like a buffet.
Right.
Uh
Yeah.
huh.
Oh,
I want to
God.
talk about birth control.
Ooh. Okay. Go,
Birth control
please.
seems like a hot topic.
It
I mean,
is.
you probably get a lot. I'm sure you get a lot of birth control questions.
Hmm.
What are and I'll see stuff online. Like I listened to a podcast recently where someone was saying that birth control, like if you're struggling dating and you want to find a partner, you should take yourself off birth control because it somehow boosts your natural pheromones and
Mm.
you're more likely to attract a partner if you're off birth control. And this person wasn't a doctor, and so I was like, man, that's just one podcast. There must be so many theories about birth control that you get hit with. Is this true, or am I just kind of making this up? Is this one podcast that was on it?
No, yeah, that's true. I think I've heard that before too. There's just a lot of I think stigma still towards contraceptive use, and that can come from I think social media. That comes from like I don't even know what to call it, but like ancestral folklore, right? Your mom is telling you that it's bad for you or something. Um, so just like scary stories that people are telling, telling people, oh, birth control is going to make you hormonal, right? It's going to give you mood swings. You're not going to be yourself. The way we're using contraceptives too to kind of alter your menstrual profile for the better also gets confusing for people as well, right? We say contraceptives because it is preventing unplanned pregnancies, but we also use contraceptives to help women with heavy menstrual bleeding, dysmenorrhea, or painful periods.
hmm
We use it for hormonal acne. We use it for a lot of other reasons, right? And so I think like when we're told it's not good because of whatever reason, we're really apprehensive to even hear how it can be beneficial.
Right. Like, what do you say to your patients that are coming in and they're like, I don't want to put all these hormones in my body because they think that that's wrong?
I mean, I'll give an example. Like, we have hormones in our body anyways, right? What they're afraid of is exogenous hormones. They don't want to take anything in because they think that that'll put more hormones in their body. What we're actually trying to do is we're trying to put them back in balance. A good example of this is PCOS, polycystic ovarian syndrome. Some of these women will have what we call oligomenorrhea, or they'll have fewer periods than we're supposed to be having. And a typical average woman, healthy woman, we're gonna have 12 periods a year. We're gonna have one every month, maybe one every 28 to 30 days. In women with PCOS, they don't have a period for sometimes several months at a time. And that's because we have way more estrogen than we have progesterone. Okay, and then when we have unopposed estrogen like that, basically our ovaries are confused. They don't know when to ovulate. And ovulation is the signal to tell our uterus when to bleed, usually happens 14 days after that. So if we're not ovulating, we're not having our periods, like that's not normal.
Is that bad for you to not have a period every month? Because I know there's some IUDs where you don't have a period. Is that bad for you?
That is a really good question, and that's something that you have to keep separate in your mind. A period is not necessary to have if we're telling your body and we're manipulating your body to not have that period, right? So you have to keep in mind, like if you think about two different kinds of women. Okay, one woman has an IUD. She has a Mirena IUD. It's a progesterone IUD. Does a really good job at thinning the lining of the endometrium or the inside layer of the uterus. And so maybe at the end of 1 year of use, maybe 20 to 50% of Mirena users will have no period at all, right? So this woman, Mirena IUD, she has no period. You compare her to her neighbor. She also has no periods, but she has a BMI of 45. She has PCOS, and she's probably has some component of insulin resistance. So maybe she's pre-diabetic, and her cholesterol is high, right? So she's obviously unhealthy. She also has no periods, but you cannot put them on the same plane. Those are two different things. They're both not having their periods, but for very different reasons, right? So for the woman who has a Mirena, she's not having her period because that progesterone is so effective, right, that she has no lining to shed, and that's fine because that's actually helping her, who she got her Mirena because she has heavy periods, and painful periods, to the point where she was missing 7 days of work a month. She couldn't take care of her kids. Okay, and now we put the IUD and we have helped her kind of regain control of her life. Okay, that's different from somebody who is not having their periods who has PCOS. Because usually, if you are not shedding that lining, particularly these women with PCOS, that lining is at risk for things like hyperplasia or overgrowth of that lining. And if you can think about like your lining getting thicker and thicker, it's just at more risk for precancerous or malignant changes. Okay, so like over time, these women with PCOS who don't have periods are at risk for uterine cancer.
So you're saying there's like this stigma where if I'm not having my period, therefore I'm unhealthy, and that's not healthy, but that's not really the case. It depends on the situation.
Totally. It depends on the context. And I like kind of what you said there. Like your menstrual profile, you should become really intimate with that. You should know, how often you're bleeding, how long you're bleeding for. Is it heavy? Is it painful? And how is it affected by whatever hormone contraceptive you're taking or the non-hormone contraceptive like the Paragard copper IUD? Kind of maybe what you're mentioning is like, and I learned this in residency, my attending used to talk about the menstrual cycle like a vital sign, right, for women. So vital signs we traditionally think of heart rate, blood pressure, O2 saturation, those things. She would also talk about menstrual cycle as being a vital sign. Like, am I bleeding? Am I not? Am I bleeding regularly? And so there are these parameters that we go by that, what is a regular period? We're bleeding every 28 to 30 days. Sometimes it can fluctuate between like 21 and 35 days. Usually women are bleeding like 5 to 7 days duration. You're probably only bleeding like 80 mLs of blood a cycle. And so anything more than that would be like heavy menstrual bleeding. And it's tough because a lot of people don't talk about their periods. You're not like, on a rooftop Sunday brunch with your girlfriends, like, oh my God,
How's your
I fucking
period?
hemorrhaged,
Right.
and last week. What about you? You know what
Yeah.
I mean? So,
It
so
seems
how
like
do we know?
unnecessary. Like if it's thin enough and it's not necessary, then that's fine. Like it doesn't seem like it serves a purpose to like. Do you feel cleaner after your period happens?
No.
So like it doesn't really serve a purpose if the lining is thin enough. At least from what I'm hearing. I mean, we're. As I told you, we're gonna do subtitles for your medical terms.
I'm on board. You're not getting it?
I
He's a
I
boy.
like.
You
No,
know the
kidding.
microplasma Guardia
I heard
leviosa?
vulva.
Vulva, that
I
was a good
heard
I
vulva
learned
and
what vulva was
vagina,
today.
2 different things. Well, I was just it just seems like unnecessary, but even though there's all these benefits, what percentage of women are on birth control?
That's a tricky question too, because it depends on like what kind, but probably somewhere between 50 and 60% of women
Oh, that's pretty
are on
high.
birth control. But
I would have thought it was higher.
You would have
yeah.
thought what
I
would you
would
have
have thought it
thought it
was higher.
was?
I would have guessed like 70, 75.
Yeah, I don't know if it's that high. I think it's also I think in the past decade it's just gone through ebbs and flows of the popularity of being on contraceptive. I think, it depends on like think what group you're talking to, but in a lot of ways, like with contraceptives, we have kind of like gained back the opportunity to live our lives. You know what I mean? So much of the menstrual cycle kind of takes you out a little bit as a woman, right? In your role professionally or in your family, in your personal life. So, and then people throughout their reproductive years go through these cycles of wanting to be on birth control and then not kind of not wanting to do it and be more natural family planning method. So I think it changes, but maybe it's up to 70%, but I think around that, like 50 to
Yeah,
70%
no,
maybe.
that makes sense. You were talking about hormones and hormone imbalance. And I've told you before, I got diagnosed like a year ago with PMDD.
Mhm.
So premenstrual dysphoric disorder.
Mhm.
Can you take a moment to talk a little bit about PMDD? Like, what would somebody have to show in order for them to be diagnosed?
PMDD has to be separated for PMS. In our menstrual cycle, we have so much hormone fluctuation, and usually it's happening around ovulation that we get mood lability, right? We kind of get sad, we get fatigued, we'll get irritable, that sort of thing. That can happen, but it also might not be bothersome to you, nor may it affect your quality of life or how you're functioning on a day to day. If they're affecting your daily life, then it is a disorder, then, right? Then we have to do something about it because it can be really debilitating for some women.
Yeah. Like, I think I've had it, for a long time,
Yeah.
but I've been on this different treatment through the Amen Clinic. Went and saw
Mm-hmm.
Dr. Daniel Amen and did the brain scans and all that and the blood work, and they were like, "You have PMDD." So I take Prozac during my luteal phase, and it's helped immensely.
Mm-hmm.
But it was like this insane hormone imbalance where I don't remember which one was higher than the other, but they were like, "It just needs to be the same. It just needs to be like stabilized, right?" And for me, like what it felt like is like I would be in bed all day. I would go into like I was a different person. I
Right.
would almost black out and I would behave in ways that felt so right in the moment where I was like, like to my husband, like, fuck you. I was leaving my husband every month,
Mm.
and just thinking that the world was out to get me. And I was
Mm-hmm.
just like
Mm-hmm.
suicidal and like wanted to self harm. And like it went to this next level
Yeah.
that like I needed to do something drastic. And that's why I went to the doctor and got it figured out. But it was debilitating for years. And it was only during my luteal phase, usually a couple of days before my period, where I'm a different person.
Yeah.
So getting that diagnosis and being able to do that research and also tracking my period. I was never tracking it. So I got an app I can track my period. My husband's on the same app. And if I'm acting away, he'll be
Mm-hmm.
like, "Oh, well, this makes sense, you
He's
know?"
like, oh, she's in her luteal phase now.
He'll
Yeah.
do that too. Like we'll get in a fight and he's like, "Where are you at in your
He
cycle?" I'm
like
like,
opens his
"I'll
phone. He's like,
Huh?
mm-mm.
It's like, "I'll ruin your life.
Like
What do
you
you
should walk
mean?"
away.
Yes.
Well,
Yes.
that's really good to get on sync with your partner. I think that takes vulnerability, and bringing your partner in on what you're experiencing can really help, especially when treatment comes on board. To just have somebody who understands what you're going through and to kind of like keep you like maybe a little compliant with your medication or something like that
Right.
is actually gonna be very supportive. I kudos for like taking your health into your own hands, basically. You're really an advocate for yourself. And I think that's a good example to any woman watching is really like, you feel like something is off. you owe it to yourself to get it checked out, you
Yeah.
know?
Yeah, and I think it was almost perhaps even more difficult for my husband than it was for me.
Mm,
Because he was like, "Who is this person? Why is she so mad at me? Why is she so unhappy? What can I do?" And so that would really kind of play into our already codependent relationship,
mm,
right? And my husband went on Reddit, and there's like a PMDD partners
mhm,
subreddit
Wow.
mhm.
where they all come and they support each other. Like, what did your partner do? How did you handle this? My partner wants to leave me again. Like, what do I do? And my
Yeah.
husband has actually gotten on the phone with some of these gentlemen he's met from um
Wow.
what's it called?
You said
No, no,
PMDD
but
partners.
Reddit.
Reddit.
He's met up
Oh,
with men that he's talked to on Reddit and like talked to them about it and was like while he was still going through it before I was properly put on the right medications and balanced stuff out. Like he was like,
Mhm,
I don't know either, dude, but like we can do this together.
so
mhm.
if you're on birth control, do you not end up having those same swings? Or can you still have PMS symptoms even though you're on birth control?
You can actually. Our first line for PMDD is going to be birth control pills, the combined pills. So you have to separate progesterone only versus combined hormonal contraceptives, which is both estrogen and progesterone. And so we would go prescribe you any one of them, right? They're kind of like basically the same, um, similar in action. So we'll give you birth control pills, trial it for about like 3 to 4 months and see how that works. If then that doesn't kind of mellow you out, then we would add on like an antidepressant like you're on.
Mhm.
So, I mean, that's great that only an antidepressant is helping you, and then
Yeah.
not necessarily for like the whole month. It's only like half the month. So that's great that you've
Yeah.
kind of found like one drug and it's like at the lowest dose and duration needed to be
Yeah.
effective. So that's
That's
great.
that's wild though. That's like half your life that you got back now
Yes.
where you feel like yourself
Yeah.
constantly.
Uh-huh. Well, I was miserable, pretty much the 2 weeks before my period, and then I would start my period and I'm cramping and I also don't feel good.
Mhm.
And then after that, I'm a glorious peachy angel for only a week out of my life.
Mhm.
And I would be, would be on my app and I'm like, fuck, like I'm ovulating soon, which means I'm gonna hit luteal soon. So like I didn't
Mhm.
even get to enjoy ovulation because I know what happens next, and it
It's wild that
sucks.
it hit. There's like, do other does this? I mean, you're obviously a human doctor, but like,
Yeah.
do other animals go through this too? Like, do people's dogs and cats like trip out when they're like ovulating and
Did
stuff?
yeah, do animals have PMS?
Yeah, like that was probably left out of the chapter books in my mammalian physiology class, but yeah, I don't know. I don't know. I would assume like all animals have some sort of pituitary and some, end organ that's producing
They have
some
hormones.
Yeah.
hormones.
Yeah,
Yeah,
they have
so
all
I'm
that.
pretty, they have uteruses too, some of them. So
Right. How common is PMDD? Because I don't think it's talked about enough. And then anytime I've brought it up in a group or like with someone, they go, "Oh my God, me too." Oh my, like they're
yeah.
too scared to even talk about it because it's a shameful thing. Like I'm acting out in behaviors that are fucking embarrassing.
It's probably around 10 to 15%.
Yeah.
And I think it's going to be underreported and underdiagnosed, right? Because then a lot of the symptoms, you might have some crossover with other like psychiatric disorders. Mood lability is with depression, anxiety, schizophrenia, all of those things. And so I think it might be underreported.
That's how I felt though, dude. Like I felt schizophrenic sometimes because I was talking to myself in my head and like saying these awful things, involuntary thoughts.
Hmm.
And I was like,
Hmm.
am I fucking schizophrenic? Like that would suck. But like that's what it felt like. I was
Yeah.
no longer in my body.
Yeah.
It's devastating. But I found a good cocktail for me. In the brain scans, they found out that SSRIs aren't going to work for my brain because my prefrontal cortex is flat from a car accident. And SSRIs will only work for me for like maybe a month. And then my body's like, I'm done
Interesting.
here. And so they're like, oh, we want to put you on Prozac. I'm like, don't, it's not going to work. And they're like, no, it will because you're shocking your system like every month. It's a new medication and then it goes away, new med. So far that has worked. I also looked into getting like a full blown fucking hysterectomy.
Hmm.
Is that, I know you and I have talked about it a long time ago. That's not really something that people, is it something people do for PMDD?
Probably not for PMDD.
Okay.
That gets into like a whole different can of worms, and I don't want to open Pandora's box, but a hysterectomy is just specifically referring to the removal of the uterus, and it may or may not include the cervix either. So, if we're saying PMDD is mostly coming from hormone imbalance and our hormones are coming from our ovaries, then if you only take out the uterus, you still might experience those fluctuations in your hormones during that cycle. I mean, maybe you're no longer bleeding, so you have no like, there's no menses, right? But there still is ovulation as long as you're premenopausal.
Got
So
it.
that could be a little confusing. But
Okay.
yeah, I can tell that like, what you were dealing with is and what so many women are dealing with is just so frustrating that you're willing to kind of go to the extreme and like
Yeah.
take this organ out of my body,
Yeah.
right?
Yeah,
Like,
that's not even the right organ. I did look up on Reddit and I wanted to rapid fire a couple things I read online on
okay.
Reddit. Just real
Okay, this
fast,
might be
just to
fun.
get like a quick, like, is this real or not or bullshit?
Okay.
Pregnancy salads designed to induce labor. Is that a real thing?
It's a real thing that people believe. So yeah, I honestly I think this started in Calabasas. I'm not exactly sure, but that's a guess of mine. But very popular in LA. The practice of maybe in your third trimester going to a nice Italian restaurant that has the quote pregnancy salad. I don't know what it is about it, but people think it induces labor. I was when my patients brought this up to me, I was kind of shocked and I had to do my own research. I was like, is there like a head-to-head like randomized controlled trial like, Caesar versus pregnancy? Like I don't know, right? But I think what it might be is like there's an old wives' tale or a age-old practice of drinking castor oil and having castor oil, thinking that castor oil induces labor, right? We don't recommend that, first of all. I'll just say that because it's a laxative. It's basically a laxative. So it might bring on contractions. It might also make you dehydrated. And maybe that's why your uterus is contracting more. So I really wouldn't do that. So maybe that salad dressing is like castor oil based. I'm not exactly sure. But no, that is
Okay.
not something that is recommended by the medical
So
field.
So that
funny.
one's bullshit. Okay.
Okay.
I have a feeling they're all bullshit. I just want to know. Okay. We might have time for two more. All right. There seems to be women that are opting to give birth on all fours versus laying on their back. Is there any like benefit to that? I went down the Reddit hole, Layla.
Depending on, what Lamaze classes you're going to, or maybe if you had a doula involved, or maybe if there's a midwife, there might be other positions that might open the pelvis more or might put baby in a different position, right? Sometimes babies, when they're going through the cardinal movements of delivery, they could be actually what we call sunny side up. You'll hear that a lot, right? The baby is looking up instead of the back of the head towards the pubic bone. So that's hard to deliver a baby like that because the head really can't flex in a certain way. So a lot of women with OP babies, we call them, where their occiput is towards the maternal back, they have a hard time delivering. And we work with midwives where I am, and they are great at using kind of different body positions and maneuvers to get that baby in a better position. So I don't want to ever kind of underplay the utility of considering other positions when we're trying to deliver if it's safe for the mom and if it's safe for the baby. And I think what often your provider is thinking of when they seem really strict about wanting you to deliver on your back, I think we're also thinking I need to be able to correct that really quickly,
Mhm.
right? And oftentimes in a position where you're on all fours, I can't really get to the baby in a way that I can like resolve that issue, whatever the issue might be.
Mhm.
So I think that's where that's coming from. I recently did do a delivery with a mom on her hands and knees. No, she was actually in a squat position,
Mhm.
which was I was nervous for that because I thought she was gonna be unstable and sit on her baby, but because I couldn't control the momentum of the baby coming out of the vagina, she kind of did have an extensive perineal laceration, right? I couldn't protect her perineum. The baby just came through. And so yeah, different positions, definitely an option, but probably
So it's an
Not
option. Not
preferred.
you shouldn't go in and be like, no, doctor, I'm doing it on all fours. Like,
right. Like
yeah.
we that is part of their birth plan sometimes is like positioning and how they want to deliver, how they want to push. Sometimes people want to even be bouncing on a yoga ball up until the time they're like complete or something. And those are things that we entertain as long as it's safe, right? We're monitoring the baby during labor as long as we feel like we can intervene and appropriately manage any sort of something that any complication that happens, then we're fine doing it. But I think also we would hope that our patients are open to kind of pivoting if that's not the right option at the time, or if there's just other like considerations that we are thinking of. And I think it's just shared decision making conversations that need to be had, and just like, and also like, respecting patient autonomy. Like, I want this to be a great birthing experience for you. I'm not trying to take anything away, but I think as long as we're all aligning that, like, we all in this room want a safe delivery, we want a healthy mom and a healthy baby. I think that we can all try to find a happy medium. But
Mm.
yeah.
We only have time for those two. I have some more. We'll
What
have
is
to.
one more though? I just want to
The
know.
other, because the last question I was gonna ask was, there's something about lotus birth, which is like letting the placenta detach naturally. So you like don't maybe you, d- I don't know what this means, but it's like you don't cut the umbilical cord. You just kind of like you leave the sac. What in my mind it was like the sac comes out, and are parents just like walking around with the sac until it detaches from the baby days later?
Yeah, I don't know what happens after they leave the hospital.
But that is
So,
happening.
yeah, I wish there was like an MTV show about like, what happens 30 days after they leave. I'm not sure, but yeah, they kind of they want those things like the baby delivers, and usually after 1 minute of delayed cord clamping, we would go ahead and like clamp, and then offer the father if he wants to cut that cord, and then you'd separate the baby from the placenta and the rest of the umbilical cord, right? But in something like a lotus birth, what I've heard of, I've never seen this really, is the baby would deliver, and then you would let the placenta spontaneously deliver after
Like you're
without
not
having cut the
pushing,
cord.
just like let it come out.
Well, yeah, without any like manual extraction, without any massage or like any excessive tugging, and it would
Yeah.
just come out, but it's still attached to the baby.
Then they, like,
Research
walk out with the baby? They, like, leave the hospital with it attached?
Again, not sure. Not sure what happens after. I've never seen it, right? I don't know if you have to have a separate car seat for the placenta. So um, I don't know. But definitely not recommended in the healthcare organization I'm
In
with
Yeah.
currently.
in modern healthcare.
Yeah.
Alright, well, look, thank you for coming on. We really
You're
respect what you
welcome.
do. You
Yeah. We're
obviously
gonna have
know.
to have you come back on because we only got through like half a sheet. Like we have so many more
Yeah, so many more
questions.
And
topics.
you obviously know what you're talking about, and just like a ton of respect for you and how you have to spend so much time debunking or explaining a lot of things. It almost feels like sometimes like we've gotten so far with medicine that now we have like the privilege to be able to doubt the medicine that got us to like the low birth death rates in
Yeah.
childbirth. Then now we can be like, oh, I want to do it the way the cave people did it, and it's like, but we're not even living the way cave people are living. So just want to acknowledge you for like all the hard work that you
Yeah.
do.
Thank you so
Thank
much.
you.
Um,
Ugh.
and we'll end it with that, everybody. Thanks for tuning in to another episode. Don't forget to like and subscribe if you're enjoying content like this. And until we see you next time, even though we didn't really talk about sex today, try something or try someone new.